So Miriam is a graduate student, now a doctoral student in our department. And she's been working on analyzing the emergency response calls in King County, which is a really unique data set because every time someone calls 911, that data goes into a database, and it has a geocoded location because they got to tell the ambulance where to go. So we not only know what time it happened, where it happened, what they were called for, and a whole bunch of other things. And now you're going to understand a little more about how that's associated with heat events.
Great, thank you. Okay, so I don't have any pretty maps to show you right now. I'm only going to be talking about the relative risk and the time series analysis, all those wonderful numbers that Dr. Yost was just discussing with you. And I may skip over a few slides in the sake of time that are not as necessary, just so you know. Like that one. And that one. Okay, so starting here. The methods that are used for this analysis are virtually the same as what was just described to you. So I'm not going over any methods again. If you have any specific questions, feel free to ask at the end. The main differences is that the study time frame is it's a little shorter. It's from 2007 through 2012. And I'm using King County Emergency Medical Service data rather than hospital data or death data, basically. So if you look at that triangle over there, that's a little bit small, and I'm sorry about that. Basically, we just talked about, where's the cursor? There it is. We talked about this section, and then we talked about this section, and now we're talking about this bottom section of the triangle. So decreasing in severity, but increasing in frequency in the population. So there's a couple unique things you should know about EMS data. It's basically divided into two levels of care, I guess I'll say. The first is basic life support, or BLS, and I'll refer to it as BLS from here on out. BLS responds to all calls. Anyone who makes a call, they're going to get a BLS response no matter what. ALS, or advanced life support, they're only called if they need extra care. ALS are they're usually the paramedics. We don't have as many of them available to us. They cost a little more. They can do a few more things. They're only called when either the dispatcher says we need ALS to come to the scene, or the BLS responder who's at the scene says we need more help. The health outcome variables are also a little bit unique with this data set. EMS responders do not diagnose patients, they treat them. So everything that we're using in this is based on what the EMS responder thinks is the most likely underlying cause of the patient that's calling, or that's the reason why they need the EMS responder to come see them. But we don't have ICD codes or anything along those lines, which people are really used to using in this kind of analysis. So we're using the EMS-specific data. We also have access to a couple more interesting, well, not more, everything's very interesting, but a couple of very interesting variables, including the necessity of transportation, so whether they can just treat on site or whether they actually need to take them to a hospital for further care, and as well as the type of location. So is it a school, is it a road, et cetera. Descriptive statistics, you don't need to see those. So there was a question about Fahrenheit and Celsius conversion with Humidex. I do have that on here on the bottom table. The 99th percentile and the 95th percentile are the cutoffs used in the relative risk analysis. I believe that all of the results that were just presented for the relative risk analysis were the 99th percentile. My data, actually, the BLS data, I should say, fits better with the 95th percentile, which is a slightly lower threshold. So that's about 85 degrees in Fahrenheit, but keep in mind that that includes humidity. That's not what the thermometer would read. So the analyses that were run for this include the BLS data at the 95th and the 99th percentile, as well as the ALS at the 99th percentile. Just to give you an idea, this is 2009. It was referenced during the previous discussion, and if you look at this figure, this is the Humidex for that summer season. The orange line at the top, that's the 99th percentile, and the red line is the 95th percentile, just to give you an idea of what we're looking at in the data and the trends that we're seeing. This does not have any responses in it at all, just the Humidex. So there are a lot of really significant results in this analysis. I have a better table that I'm actually going to go to in a second. But basically, for all causes, all ages, all three analyses had significant results. Same with non-trauma, all ages. It's kind of a big deal. Increases ranging from 8% in the BLS data for the 95th percentile, all the way up to 16% for the BLS data for the 99th percentile. No, the relative risk. It's just relative risk, yeah. So that's, yeah, it's relative risk. That's on a heat day compared to a non-heat day, not per degree, just to be clear. So this is, I think, a better image of what that looks like, what the data looks like. Everything bolded is a significant result. You can see at the top, the all ages, they're almost completely seeing an effect, as well as for all causes and non-trauma, there's effects in almost all age groups as well. Some of them range near the bottom, you can see, or the 15 to 44-year-olds, 22% for non-traumatic. So there's quite a few good results there, or sad results, I should say. The BLS data, it was the primary focus, or at least my primary focus. So I've got some additional information for you regarding that data set. For subcategories of health, these were the really the significant ones for that as well. So we have abdominal, genitourinary, we have alcohol and drug, anaphylaxis, allergy reaction, metabolic, endocrine, diabetes, neurological, other medical, and then heat illness and dehydration, with heat illness and dehydration having a very large increase of 3.43, so over 300%, basically. By age group, all 6 age groups, well, you know, I'll show you that one that looks better like this. So you can see here, hopefully you can see here, the other medical and heat illness and dehydration are significant across all age groups. Same with, oh, that's the only one. All causes and trauma and non-trauma have significant results in all but the, for the most part, all but the 85th or 85 plus age group. And then there's also quite a few significant results in the all ages for all those categories. Transportation for the relative risk analysis actually is, well, there's increases just across the board. So there's increases in no transportation necessary, increases in BLS transportation, and increases in ALS. So I'm going to talk about that a little more with the time series analysis. For the time series analysis, and I really wish I'd grabbed that beautiful graph that you just showed, because I have a similar beautiful red and blue graph, or table, or chart rather, but figure, that's the word I'm looking for. But anyway, so for the time series analysis, the thresholds that were selected, that upper threshold, is actually a little bit higher than what was just presented. It's 40.7 degrees C for the BLS data and 39.7 degrees C for the ALS data. The previous analysis, I believe, was 36. So just to keep that in mind, it's a little bit higher. It does also mean that, especially with the restricted years of this analysis, there's limited data involved. So there are some issues with statistical, or with power. Thank you. Anyway, keeping on track. So for all causes, all ages, 6.6 and 3.8% increase per unit or per degree increase in Humidex above those thresholds. Those are pretty big. BLS only, there's a whole bunch of, I don't have all the numbers listed here because there's just too many numbers to put on this slide. But I do have them in here to give you an idea of what we're looking at. Yeah. So the transportation in the time series, oh, it cut off the top. In the time series analysis is, I think, somewhat interesting because it does show that no transportation, as well as BLS transportation, but more so no transportation, is actually more significant than any transportation. So we're actually seeing that people are not needing transportation above that, that threshold, which may mean that it's because they're being able to be treated on site, and it's maybe, I mean, I can think of different reasons why that may be, but they would just be my guesses. I'd have to look at the data a little more for that. But anyway, that's what we're seeing. A few limitations of the data. My acknowledgements, which I'm sure that I should include that entire list that you just saw as well. But this is my specific personal acknowledgements of people who are involved here. So, okay, that's all. I'm moving on. Go ahead.